Hello and welcome to CT Edu Series, Topics in Reproductive Health. This is Ann Mullen from Cycle Technologies, and our discussion today will be about how long it takes to get pregnant when a woman is trying to conceive. It's a topic that's part of our work here at Cycle Technologies and something we wanted to explore in detail so we could share this information with others, especially women who are thinking about getting pregnant. And we find that this is an especially pertinent topic nowadays in light of fertility apps for smartphones and also web services that are trying to help women get pregnant fast or even get pregnant faster. And I've always wondered exactly what this means, to get pregnant fast or faster, and faster than what. So I wanted to speak with an expert in the field and am delighted to have Dr. Richard Fehring joining me for a conversation about all of this. Dr. Fehring is a fertility researcher at Marquette University and has authored a number of scientific articles, including papers related to this very topic. So welcome, Dr. Fehring, and thank you for joining me.
And I'm pleased to join you and have this conversation about getting time to pregnancy.
You know, there are so many things to talk about on this topic, and for the sake of having our conversation be in time limits, I wanted to focus on three main points. Firstly, how long does it in general take women to get pregnant? And secondly, with that information, in practical terms, what should a couple know when planning to get pregnant? And finally, just a few tips for women and men about how to nurture their fertility.
Sounds good to me.
Okay, so first of all, I hope you can see there that we have a picture of 100 women with the intent to get pregnant. Can you view that, Dr. Fehring?
Yes, I can.
You see that?
And they all look happy right now.
They all look happy with expectation. Well, yeah, if you could bear with me just a minute, I wanted to give people who are watching an idea, like over time, over the course of a year or 2 years, what it looks like timing-wise and how many women will get pregnant over that time frame. So I've reviewed a number of studies and surveys, including information from your papers, Dr. Fehring, just to see what the trends are for when women get pregnant. You know, and it was really interesting to see that the numbers were pretty similar when women were both simply having frequent intercourse over their cycle without using any app or something like that, and then also women who were using an app or an online service. So over the course of time, the numbers were pretty similar. So if we look here, again, we have 100 women. After 1 month, we have a little over a third or a little greater than a third, about 38 women were found to have conceived, and that's after the first month.
Mm-hmm.
Then going to the 3-month mark, about 30 more women will conceive. So you've got about 68%. Some surveys showed a little more than that, closer to maybe 70. By the half-year mark, by 6 months, about 13 more will conceive, so you're up to about 81 or about roughly 80% of women at the half-year mark will have become pregnant. And then going another half year, you've got a number of women, about 6-ish more, who will become pregnant, and you've got 13 or more or less that after the year mark have not yet conceived. And then I wanted to take that just one step further because there were some studies that talked about a second year. And one study had mentioned that of women who don't conceive in the first year naturally, about 60% of them will conceive naturally in the second year. So that leaves us about 5 women who will not have conceived after a year. So just to review, you start out with 100 women, and at maximum 2 years, about 5 people will not have conceived. Now, I know, Dr. Fehring, that doesn't mean that these women can't conceive, and I was wondering if you could talk a little bit about what is the difference between infertility and sterility. So if you have 5 women left.
Okay. Infertility is defined in the medical or health literature as over with couples having unprotected intercourse over 12 months of trying, and if they're not pregnant by that time, then they're put into the infertile category. So that's called infertility. So they still have ability, however, to have children. Sterility just means that they have been sterilized, or some reason they cannot have a child for some reason or another. So there's no fertility left over.
So there might be something.
No.
How about fibroids and things like that? Is that considered just a difficulty, or is that?
That'd be a difficulty. Fibroids can be surgically removed. In fact, I was just reviewing a case before this about women having fibroids and having removed and got pregnant in that. So, fibroids are a reason for infertility. Ovulation disorders and things like that are reasons for infertility, but not necessarily sterility. If a woman has hysterectomy, obviously you'd be sterile.
Right.
And if her tubes are damaged or that, there's still a chance for pregnancy through IVF and things like that.
So there's always I was just going to say, so it sounds like there's a lot of hope, and you can see I put some percentages up here, kind of by age. And part of the intention here was to, I guess, encourage women to let them know that true sterility is really a rare thing, and that a woman shouldn't underestimate her fertility. What would you have to say about that?
I agree with you, and however, there is some age, as you can see, as you're going through the age, that as the older, that there is a less chance of getting pregnant. However, that goes way into the early 40s before that happens. Mm-hmm. And I agree with you that women trying to get pregnant, especially nowadays, they go onto websites and sometimes they get into loops of people that are not getting pregnant, and then they get anxious and things like that. So there's really not a good reason for that. I would also say in that earlier figures that you had in regards to the first 12 months and then the 24 months is actually rather conservative, but that's based upon what. Yeah, my data that I just recently looked up was about from 8 to 15 in the first year, not getting 5 to 15 in the first year, not getting pregnant. But what group of women are you looking at? If you're looking at all women, it's probably around 10 or so on the first year. I just looked at recent data from our website, and women who already have become pregnant, in other words, they established their fertility, we only had 5 that were not pregnant after 12 months. Whereas those that have difficulty, it was something like 24, but then after 24 months, it went down to 13. So,
yeah,
so there's just some other figures in regards to that. It always relies upon what women are you looking at. So,
right. No, that's really a good point. But that's also very encouraging, I think.
Yes.
Again, like you said, and also with women delaying pregnancy or starting establishing careers before they want to start their families, and I know that women can get into their mid to late 30s before they start thinking about it, and then sometimes I think for some women a bit of a panic sets in, and I think too,
And if they're busy and they have careers, they try to time it maybe during the summer or time's off and things like that. So that adds a little bit more anxiety and stress. And stress is not the best thing to have when you're trying to get pregnant. So.
Right. So again, I hope these are encouraging statistics, because it seems like, and correct me if I'm wrong, but there's still a number of women who can get pregnant naturally in the later age. It just might take them a bit longer. Do you think that's fair to say?
Yeah, I would say that, especially after age 40, but there's still hope until around 44, 45 or so.
Mm-hmm. Also, even that late. So at age 45, about what % of women could expect to have a realistic expectation of getting pregnant?
Not too many. They say there's approximately 50% at about 45, and when they're around 47, 48, it goes down to 1 to 2%. Mm-hmm, mm-hmm. So But there's not a lot of women that get pregnant after 45. However, there is hope for women in the low 40s. So, especially if they keep healthy and do the right things for their health and for their fertility, overall fertility. However, I would still encourage women who are thinking about wanting to have children to look at it earlier in their life, because they have the best probability then.
Right. So, and I was going to ask you that. So, let's say a woman, she's just starting her career and she has a lot of things, different things on her mind and to think about. But what would you say, I guess, not a cutoff age, but when would you say at the latest she should, start thinking about getting pregnant?
Huh.
I know that's a difficult question, but I think people do ask it.
Well, I would say if you look even at your slide there, age 25 is the optimal from 25 to 30. Actually, from 20 to 25 is probably the most optimal for the body and everything. Mm-hmm. But obviously, from 25 to 30, so they usually say that after 35 is when the fertility really starts going down pretty much, and that's due to having less eggs. A woman has the most eggs in her ovary before she's born. And then she keeps on losing them. By the time she is born, she loses, I think, almost half. And by the time she starts puberty, it's about 400,000. And then she usually ovulates about 400 times throughout her lifespan. So by 35 and getting towards 40s, the number of eggs in the ovary start decreasing. The other thing that happens, both for men and women, is the eggs and the sperm also get old. And so that has an effect on fertility.
And so to the sperm, so my understanding, the woman has her eggs since birth, but the men produce sperm. And you're saying the thing about age, how does that affect sperm then? I mean, I understand eggs getting older, but I'm wondering about the effect on sperm.
Well, even age affects sperm, and they have shown that women who are married to older men or partner of older men have a lower probability of pregnancy with older men, because of the sperm also get old. That whole mechanism, everything, spermogenesis, developing sperm, it gets older in that, and there's more sperm actually in the semen that probably are not able to fertilize an egg.
Okay, well, that's interesting.
Even though theoretically a man is fertile until he dies, but they have shown more and more that it has decreased. In fact, just came out lately that another study showing that there is more a factor on that.
So more than people believe.
So I guess if a woman wants to get pregnant, she should find young guys.
Find young guys. Yeah, very good. Well, to that topic then of things to be aware of. And I think, talking about the age of egg and sperm and so on,
sure.
Here are some things maybe for people to know about when they want to get pregnant.
Definitely.
One of the things that's, I think, commonly known among at least academics in fertility is the 6-day fertile window. Could you talk about that a bit, and what should women know about this fertile window?
Well, there's a number of studies that show there's about a 6 to 7 day fertile window, actually more 6-day, and through studies where couples have just intercourse at one time, and they showed that during a 6-day fertile window, the day a woman ovulates is essentially when a woman is fertile, and the egg, however, only lives about 20 to 24 hours, and actually it's probably about 12 hours that the egg is fertilizable. But the 5 days before that is part of the fertile window, and the reason that the 5 days before is that a woman's cervix becomes a good environment for survival of sperm. So if a couple had intercourse on 4 or 5 days before, sperm can live in the cervix with nurturing cervical fluid and get pregnant when she ovulates 5 days later. However, of that 6-day, the 6-day fertile window is the only time that a couple of women can get pregnant. However, we know that the most fertile days are the 2 days before ovulation. And actually, there is actually there is about on average a 3-day fertile window. That 6-day is for all time. So it's about a 3-day fertile window up to 6 days. 6 days, however, is much less frequent.
So it sounds like 3 days
So,
is your maximum effect, but there is some chance.
the maximum, yes. Oh yeah, there's about I think the first day of the 6-day fertile window is about 11-12% or something like that. But it goes up to around 30% the day before, 2 days before. Now, that's with younger women, younger men. As you get older, that fertile window, the probability goes down in each of those days. But it's good to know the fertile window because I know there's a whole bunch of studies just recently showing that college students don't know about this time of fertility, and even couples trying to get pregnant have difficulty. We're unaware. About 25% only knew about the fertile window in regard to getting pregnant.
So it sounds like that's the key thing when you're wanting to get.
Certainly. In fact, our okay, go on. I'm sorry.
Oh no, I had read somewhere, and I think it was perhaps the organization, the National Organization for Infertility or something like that, said that about 10% of infertility is actually mistimed intercourse.
Mistime, yeah.
So, and speaking of that, so I have another point here called targeted intercourse. It sounds like an academic term. What would that mean? And how is that helpful?
Or another term. Another term is focus intercourse.
Focused.
Well, how do you find that fertile window? Well, you really wouldn't need to have to find it if you have frequent intercourse, and people have shown that frequent intercourse is one way of getting pregnant, and some people even recommend every other day intercourse because the sperm volume and the health of the sperm is at highest when you have frequent intercourse and not have long delays of abstinence.
I know I've heard some people say, well, you want to wait because you don't want to deplete the stores or something like that. So it sounds like what you're saying is that the opposite is true.
That the opposite is true. However, and other people just say if you have frequent intercourse, you automatically will be hitting the fertile window. However, I would hedge the bet in trying to find the most fertile days in that fertile window if you can. And there is a number of, well, you could have frequent intercourse and that'd be fine. But the other ways are trying to focus your intercourse during the estimated fertile window, and there's a number of ways of doing that. The most common way that people utilize is checking for their cervical mucus. Mm-hmm. And when the mucus becomes like a egg white, real slippery, profuse, that is a optimal time to have intercourse. And a recent study by Dr. Stanford and other people have shown that women who are consistent in looking at their cervical mucus and having intercourse during that maximum type of fertile mucus, that they're more tendency to get pregnancy faster. But if they're not consistent, they didn't show that.
So it would be good for women to learn how to observe that.
Yes, it can be very helpful, but again, it has to be consistent in utilizing that and being aware of that good fertile mucus. That's usually a good time to have intercourse and targeting it. We have taking the temperature doesn't really help. The temperature, once the temperature goes up, that happens after ovulation. A woman's temperature goes up because of a hormone called progesterone. But that's a post-ovulatory. Once a woman ovulates, she only has about 12 to 24 hours. And so when the temperature goes up, she might already have missed her fertile window. So temperature is really not a good indicator. However, we now have pregnancy LH test kits, or what they call ovulation test kits. The LH surge happens about 12 to 36 hours before ovulation. So that's a good time as soon as the rise in the LH surge in these LH test kits. Some studies show that might be a little late too, but it's helpful. And there are other monitors that also measure the estrogen rise, where they have high fertility and also peak fertility. And they can help target it. So, but those expensive things, I don't know if people are trying to get pregnant if they really need it. Obviously, cervical mucus is available and would be cheap, but if they want to hedge their bet, they could. Our study that we did looking at couples targeting intercourse in high and peak fertile days with mucus or with these fertility monitors measuring estrogen and LH, they had 88 pregnancies over 12 months versus 5 not having intercourse on those days. So it's just important to show that focusing on those fertile days is important for getting pregnancy faster.
All right. I think that's probably an excellent point, a key point.
And there has been 1 or 2 studies showing that using these monitors in a randomized that they get pregnancy more likely to get pregnant. But there's not a lot of studies doing these comparisons. So
I guess, yeah, comparison studies would help whether it's faster or not.
Yes, but they're hard to do.
They're hard to do. So
yeah.
If you have the sperm and the egg and they meet each other in the fertile mucus, that doesn't always mean that someone's going to get pregnant. I was wondering about things, the uterine environment and so on. I mean, what other things might be a factor in successful pregnancy?
Trying to get pregnant?
Right. Mm-hmm.
Well,
or are there other? So the reception in the uterus, is that a factor?
I missed that. What you said? I'm sorry.
Oh, if conditions, for example, in the uterus, if let's say there were fertilization, doesn't always necessarily mean implants. Is that correct?
Well, there could be a lot of other things that could interfere, like we mentioned before, with fibroids or things like that. I also know that there's some theory about that intercourse outside the fertile window helps prime the cervix and the vagina and that for being more receptive to the sperm and everything.
So that's an argument for the frequent intercourse and not necessarily focusing it during the fertile window. Is that right?
Yeah, I guess so. Yeah, in fact, some of the studies I have seen that if they have intercourse every day, just about, and also outside the fertile window, that's the highest probability. But again, there's not a lot of, that sort of probability studies. That's not comparison studies. So.
Okay. Well, I just wondered if there was anything else that people needed to keep in mind. But with that information, then I was thinking, okay, what does that mean? Sorry?
There's also lifestyle. There's a lot of lifestyle factors too that should be considered too.
Mm-hmm. And I would like to touch on that a little more toward the end of our discussion.
Oh, okay.
When we talk about nurturing fertility. But with all that information we've talked about so far, so how long it takes to get pregnant and things to think about. So just for a practical plan for a couple, if they want to get pregnant, so here I have some time marks here, 6 months, second 6 months, and the end of a second year.
Oh, sure, yes.
How do you think how would a couple start out? I mean, it's not a prescription for them, but what's something that someone might think about for a start?
Well, usually if the woman is 35 or younger, they should not worry if they don't get pregnant. Actually, the highest probability of pregnancy is the first cycle in the first 6 months. But for normal couples, people really aren't concerned until after 12 months of trying. After that, they might want to try targeting, focusing their intercourse and that. But they probably should maybe go in and get a health check, things like that. Mm-hmm. Once they're around 35 years old, if they haven't got pregnant within the first 6 months, it's recommended that they seek primary care and checks for other things. The women could have polycystic ovaries syndrome that needs to be managed. It could be fibroids, it could be endometriosis, and or low thyroid. So some of those things are pretty simple to be able to diagnose and manage and things like that. So those are some of the things that they might go to a primary care professionals to have checked out.
Mm-hmm. So if I'm understanding you right, if a woman under a certain age for the first 6 months maybe wouldn't necessarily need to have extra help or be buying expensive monitors and so on. If she just had frequent intercourse, the first couple cycles,
or
she may
cervical
just get
mucus.
pregnant.
Being aware of the cervical mucus is pretty easy. So.
Right, and then you were saying at about the 6-month mark, if someone's not pregnant, it sounds like maybe that's the time that someone might think about, get that
If,
app or
if,
get that.
well, if they're 35 and older, I would say yes.
Mhm. And so then maybe after a year, if someone's younger than 35 and they're still not pregnant, then is the target or the focused intercourse or maybe the monitors and so on, is that the time when you pull out all the stops and bring all those tools in?
It would be helpful, but I wouldn't go overboard with it. Helping to, certainly they could get some ovulation test kits or monitors and things like that might help them. But I would be concerned there's monitors out there that people market that aren't really helpful, aren't very good at targeting the 6-day fertile window or estimating it.
So are they missing the window, like you were saying, like maybe detecting the ovulation too late, or maybe not at all,
or not at all, too late or not at all, or maybe they are only have intercourse on when they can on the weekend and things like that. So yeah, I would say it's good to make sure that they're looking trying to focus their intercourse at that time. It'd be helpful, let's put it that way.
Okay, so then you've got the end of a year and maybe even the end of a second year if someone's still trying to get pregnant naturally. At what point would you recommend to a woman or a couple that they seek infertility evaluation or infertility treatment?
Okay, as I mentioned before, for a normal couple trying to get pregnant and they are consistent in having intercourse after 1 year, it's good to get a checkup.
So after 1 year.
Yes.
So no panic until
for a couple who is 35 after 6 months, and that is if they are actually targeting intercourse during the fertile time. Mm-hmm. It's good to get a checkup because they have a little less time to play around that went to 35, and also fertility goes down around then. So
it sounds like for the most part, the first year can be pretty uncomplicated.
I would say so.
Mm-hmm. Well, I think that's good practical information.
But there's a lot of fertility apps out there, and the internet. I know at least 5 years ago, women are the number one users for health, internet information for health, and one of the number one questions that they look for is getting pregnant, or am I pregnant, type of thing. Mm-hmm. Can I get pregnant?
No, well, that's interesting, and I think we've seen that too. Obviously, we work in the field, and we get a lot of questions from people. That's good to know that women are the most interested in that, and look to the internet.
Which is good, I think, but also you have to have sites that are credible, like WebMD and things like that, Mayo Clinic. When you start getting in some of these websites, I think sometimes you get into a loop where people get anxious because they're seeing people getting pregnant, they're not pregnant, and then there sort of takes over in regards to this anxiety among these group of women on these websites. In fact, even on our website, I noticed that, and that's why we have to monitor very closely to make sure that they have good information and not blow things out of proportion.
Oh, that's interesting. So you have a monitor in case people have questions or false information?
Oh, we're on there. We're on there every day. Yes.
Well, that is interesting. I mean, the communities are very helpful. I know that people look for support from each other and so on. But at some point, you want to, I guess, make sure that it's correct information. I wanted to go on then. We were talking about ways to nurture your fertility, and you talked about sperm quality and so on. So I've written just a few tips here. I don't know if these are the ones that you might say initially, but avoid drugs and excessive alcohol use. Is that both for men and women?
Yes, definitely. What do you mean by drugs?
I guess things
illicit drugs?
Illicit, yeah. I guess someone's doing cocaine or they're things like this.
And marijuana, obviously, is one of the big ones that they say avoid.
What does that do to a person's fertility?
Well, it
Especially
decreases
in
it.
light of the, it's being legalized and so on, and maybe people aren't aware what that could do.
All I know is that that's one of the factors in regards to both men and women, that marijuana use decreases fertility, the chances of getting pregnant.
Mm-hmm.
So
So
it's
if
not,
someone is,
and any smoking, smoking cigarettes also do that. Probably, one of the theories about it causes hypoxia. In other words, not good oxygen to the ovaries, the eggs, and things like that, and the men's reproductive system.
so on both sides it can cause a
Yes.
decrease,
Mm-hmm.
and then I
Oh,
guess
definitely.
combined,
Yes.
that's not a good combination.
Mm-hmm.
So let's say someone was using drugs or smoking marijuana or that sort of thing. How long would they have to have quit before?
Phew. That I don't know, but I would just suggest that they quit. And um, I do know that women who smoke, they are more likely to have premature ovarian failure. So faster they quit, the better it is for their health, reproductive health.
Mm-hmm, mm-hmm. Now, I also have on here maintain a healthy weight, and I think that's generally directed at the woman. I think because
Well, it's generally the women, but it's also for both.
okay. So if you're overweight, lose weight. If you're too skinny, you should put on some pounds. Is that correct?
Yes, you need some fat in order to ovulate, and being overweight. We even conducted a study at Marquette and showed that people who are overweight, especially obese, that they ovulate. They do not ovulate as much as women who are normal weight. So that certainly is a factor that's important.
Mm-hmm. And then also we have avoid environmental toxicants and endocrine disruptors. What would be an example?
Well, that's a good question. I think some of the endocrine disruptors are, the plastics and things that mimic estrogens and things like that. And I know that has affected, in epidemiological studies, sperm count and things like that. But obviously, any toxins that's in the environment you want to avoid, and I think that's working like even in the coffee industry and things like that.
Oh, okay. So I guess depending on your employment, you might be near chemicals that could affect your
Yes, yeah.
fertility. And I also have on here, don't underestimate your chance of becoming pregnant. We talked about that before. Don't necessarily panic if you're not pregnant right away. And
I would also.
Mhm.
I would add a few other. Having a good diet is important. Not only gaining weight or losing weight if you're not in that normal range, but also a good diet that you have a lot of vegetables and fruits and everything and grains. Sort of like the Mediterranean type of a diet is helpful for people that they recommend. However, the Harvard fertility diet also recommends that a woman have some fat in her diet, and not be using like non-fat milk and non-fat dairy products, but actually have some whole milk or ice cream and things like that in her diet. Not overdoing it, but because you need fat to produce the hormones in order to ovulate. So that's important.
Well, no, that's a really good tip because I think it's a bit counterintuitive these days when people are trying to avoid,
they
especially
might
whole
get.
milk and ice cream. It always seems to be a no-no in some diets. So good
Yeah,
for
but you need.
women trying to get pregnant.
Yeah, not overdoing it though. Just some fat in
Don't
it.
eat a gallon in front of the TV.
Yes. And exercise, regular exercise has shown to be helpful. Not overdoing exercise, however. If they're on marathon or something like that, they might just be suppressing because to ovulate and to get pregnant, you need to have enough energy to do so. And if you deplete that energy, the ovulation will be suppressed.
And I would encourage people who are listening to this webinar that we have done some previous webinars in our Edu series on fertility literacy with Dr. Mary Lee Barron. And she goes into detail about this topic for women and also for men. and then she did a very interesting one with us about sleep and the menstrual cycle and how
Very,
hormones
very
are
important. Hmm.
So I would encourage,
So yeah, 7-8 hours of sleep is very important.
yeah, who knew? Well, I guess
Yes,
in general, a
and
healthy body.
I would also deal, managing stress appropriately. Part of that's getting good sleep and exercise and diet, but also managing stress.
So at your
Because,
workplace or at home and so on.
yeah, and high level of stress and doing too much in regard to, cortisol levels are up, and that is a factor affecting fertility, and that stress hormones are
Well, also
affected. So
very good tip there. So
now I would also recommend one other thing that's very important, that women who are trying to get pregnant, that they take folic acid, because that's very important as a supplement.
and would you recommend folic acid in prenatal vitamins, or you mean just a separate
Yeah, yeah,
supplement of?
yeah. Prenatal vitamins be fine. Yes.
Mhm, mhm. Very good. Well, we've come to the end, I think, of our discussion here without running too long. And Dr. Fehring, we've discussed quite a number of factors that contribute to achieving pregnancy. And you've just given some great tips about nurturing your fertility. And I was wondering if, in general, do you have top 2 or 3 tips that you would give women when it comes to getting pregnant or getting pregnant fast?
I would say number one is have a healthy lifestyle.
Mm-hmm.
And we talked all about the indicators of having a healthy lifestyle. I would recommend, having pretty frequent intercourse, but, not frequent intercourse throughout the whole cycle, but, trying to be aware of when the fertile time is,
Mm-hmm.
would be important. And then the other is, not get overly anxious if you're not pregnant by, the first 6 months or so.
Right, like don't underestimate your capability to get pregnant.
Yes.
So don't stress. Well, I think those are fantastic tips. And for anyone who's listening, if you have questions for us at Cycle Technologies or for Dr. Fehring, you can send an email to info@cycletechnologies.com. And the other webinars that I spoke about are also viewable on the Cycle Technologies website. There is a section of Edu Series. So Dr. Fehring, thank you so much for joining me for this. It was great to get your knowledge and insight on this topic, and I hope other people have learned something as well. So take care, and goodbye for now.
Okay, thank you. I enjoyed the conversation.